Hey guys, welcome back to another episode of What Did the Patient Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are bringing you inside information from real conversations we have with patients on a daily basis. We get asked the same questions and want to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hi, welcome back to another episode of What Did the Patient Say? With myself, Dr. Dana Brindisi, and my sister, Dr. Lauren Brindisi.
Hey.
We are the co-owners of Carolina Functional Neurology Center, and we're bringing these videos to you because we talk to patients every day and have very similar conversations, and we want to make sure that we're putting that information out there to everyone, and hopefully it is helpful in some way, shape, or form so that people can get the help and the care that they need forward. And today we are going to talk specifically about migraines and different things that we talk with basically all of our migraine patients about, the different avenues that lead to migraine, the things that contribute to migraine, what migraine actually is and what we know from the research now versus what we thought even maybe 10 years ago. There's been a lot of debate about what migraine actually is, and we now know that it's a neurological disorder, and we're going to kind of dive into that a little bit more.
Awesome. So what I would love for you to answer, Dr. Dana, and talk a little bit about for people is kind of setting the stage of what is going on with migraines and what types of systems do we see that are associated.
So true migraine at its core is a genetic predisposition to have an altered function of your brainstem mechanism. There's been a great migraine debate for many, many, many years, whether it was a vascular issue or a neurological issue. And we now know that migraine is truly a neurological issue, and it's the way that the nervous system is controlling and impacting the vasculature, which is why you have that vascular component. And most migraine patients, express their pain in like a throbbing, pounding type headache, and that's because it is affecting the vasculature. But when we talk about migraine kind of on a global scale and from a functional perspective, we know that there are, four main contributing to factors to migraines. And if you guys follow us on social media or anything like that, you've probably seen these posts, because what happens with a lot of migraine patients is they've done a food diary, they've gone to their chiropractor, they've tried acupuncture, they took progesterone, right? And they've, done all of these individual pieces, but sometimes none of them are done at the same time. And there's four major components. So when we evaluate a patient for migraine, we want to know how is their nervous system functioning, what their nutrition is like, are their hormones regulated, and then what is going on with their biomechanics, so the joints and the muscles, especially of the upper back and neck when we talk about migraine. And those are the four major players. So when we as functional neurologists address a patient, right, we want to know, have they addressed any of these things? Have they noticed any change, good or bad? And if they have or haven't, we want to make sure, because somebody could have all four components, right? Somebody could have all four contributing factors, if you will, to their migraine. What we don't know, and there's no way for us to test, and maybe in our lifetime that will change, but we don't know, is it 90% neurological and 10% the other three, or is it, 25% of each? And what we find as the best approach is kind of treating all of those things simultaneously, because most of the patients have done some form of something, right, to address their hormones or their biomechanics or their nutrition. And also a lot of times there's this neurological piece that is missing, and that's kind of where we come in. So maybe you can kind of elaborate on that side of things.
Yeah, I mean, anyone coming with migraine, you know that you have a neurological component. Hands down, that's like really the top priority. And then the question is, are these other pieces a contributing factor? Kind of like Dr. Dana said, we used to think about migraines as a vascular issue. And a lot of that, from my understanding, is coming from a little bit of trial and error with the various medications that affect the vasculature, and people were getting better. So that makes total sense and logical thought process to say, well, if we're affecting the vasculature and they're feeling better, this must be related to the vasculature. But now we know, and there's plenty of studies out there that are explaining and allowing us to expand and elaborate on our understanding of migraines as a central nervous system disorder. And the wording that gets tossed around is this idea of central desensitization, which basically just means the central nervous system in migraine patients is processing the information a little bit differently. And depending on the severity of your migraine and what type of migraine, it might be a different area of your brain that could be affected. And the overall integrity of that area or multiple areas is just not working as optimally as it could be. And now you become symptomatic in response to things that should be a part of your normal life, right? So that could be bright lights, that could be a car ride, that could be reading, that could be certain foods or smells. See, all of this has to do with sensory information and pushing that limit over the edge. But now it's being pushed over the edge from something that shouldn't be creating symptoms. So when we think about it that way, it makes total sense to look at the brain functionally and try to find out where in the brain for one migraine patient versus the next is that area of dysfunction coming from. And that makes a lot of sense when you start talking about atypical migraines too, right? So now we understand that some people don't even have pain associated with the migraine. It's not just a classical, like one-sided headache issue. This is where in the central nervous system is being affected, and the same type of process is happening in which this processing is changing and becoming oversensitive. So that's why now we start seeing and understanding, right? There's those typical classical type migraines, but then we have patients who have hemiplegic migraines that look a little bit more like they're having a stroke, and they most often end up in the hospital worried that that's what's happening, but it's
Or
not.
basilar migraines can look similar, where they have a lot of the facial.
Yeah, they can have like drooping, like paralysis on one side.
Heaviness, fatigue.
Yeah, we see vestibular migraines.
Sedated.
Yeah, vestibular migraines where people get like dizzy, vertigo type episodes. They might be really sensitive in the car. And then we start looking at pieces of their central nervous system. And it's more about, I feel like with the diagnosis of migraine has a lot to do with the episodic patterns of what's happening and not so much just classically associated with the pain itself, right? And that changes the whole thought process. We now know, people get diagnosed with abdominal migraines, usually more often seen in children, but that's not a headache issue, right?
And some people that have those atypical migraines also have a full migraine pain associated with it. And so sometimes they have those symptoms. It's almost like prodrome to the actual migraine pain too. So it can do both.
And crossover, yeah, and spread, right? So I have a patient, she's in her 50s, and she's been dealing with migraines since she was 15. And it's really important in our world that we start talking about the history and uncovering, like, where did this really start? Because her migraines have just continued to progress and worsen. And the way I'm looking at it and thinking about it is it's just this central desensitization is spreading to other areas of her brain, where she used to just have like a classical, right-sided migraine pain. Then it started sort of sometimes shifting over to the left side. Then it started shifting over into her body. So now she's got hemiplegic migraines, and that's left her with issues with mobility even after those episodes, because they become so severe that the overall function of those areas of her brain don't just ramp up and then come back down. She's actually left with like lasting changes in her mobility and stability on the whole right side of her body. And I'm just thinking about that. Like I said, it's kind of the whole issue just keeps progressing for her. And now she's kind of moving through all these different types of migraines, but it's all really the same thing.
Right. Yeah. Yeah, for sure. And I think kind of along with that, I would like people that are listening into these videos to understand about migraine and the neurological cascade that is happening in a migraine. And that goes for basically any type of migraine, right? It's just the severity changes depending on the person. But that alteration in brain function is happening sometimes days before someone would ever actually have a symptom of a migraine. Yeah. So a lot of migraine patients will tell you, like, before I really got a full-blown migraine, they're like, I noticed something, right? And it's because this cascade of neurological dysfunction is happening days before. And here is the biggest kicker, and something that I talk to migraine patients about all the time is like, do not drive yourself crazy doing like food diary after food diary, or like tracking every single thing that you do on every single day and try and match it up to your migraines. Because in reality, that's all you're going to do is kind of drive yourself crazy. Because if you don't find that one thing that you think that you're looking for, it's because you may have done something 2 days prior and ended up with a migraine today. But what you're doing is just reeling of like, well, what did I eat this morning? What did my morning look like? Was I more stressed this morning? And it may not matter. It may not have anything to do with what you did today. It could be 2 days ago.
Yeah.
And it's because this neurological dysfunction is already started and is already happening well before you will develop like true symptoms of migraine.
Yeah. And I mean, we do talk a lot about triggers, and sometimes there are distinct things, right? People are like, every time I eat chocolate, I have a migraine. But a lot of times it's multiple factors, and can be simple things that are just a part of your everyday life that are starting to build and pile on each other before it like overflows into completely symptomatic. So from a neurological rehab perspective, it really is the ideal way to treat these patients, because if we can activate and exercise these brain regions and get the integrity of their resting potential and their what's called your metabolic capacity, basically how much stimulus can you take in and process without being symptomatic, right? And that's the whole goal. People who don't have neurological symptoms, right, they can push those limits all day long and not become symptomatic. But we know when you're dealing with migraines that you are becoming symptomatic. But if the overall integrity of those brain regions improves and we can make the good pathways more efficient, then we can override the bad pathways, and you can handle more stimulus in your life without having it overflow to a full-blown migraine. And we see that too, right? So we'll start seeing patients who, their migraines go away, and what we kind of see is like the frequency, intensity, and duration starts to lessen. And then maybe people only have the aura, and they go, well, I thought I was going to get a migraine, but it didn't lead to a full-blown migraine.
Yes.
And that's huge.
I love hearing that from people.
I know. Yeah. That's a big sign that, you're moving in the right direction. On the flip side of that, if you have migraines and now, when you were in high school, you had them, just a couple times a year, then you went to college and it became, once a month. And now all of a sudden you're having them every day. That's not okay. You're moving in the wrong direction. And we want to turn that around and get you moving.
And sometimes that is what pushes people to like do some more investigation, right? Like sometimes people are like, I get one maybe once every few months. But if I would say, even if you used to get one once every few months, and now you're getting one every month, right? Seek some help there, right? Like don't let it get to the point where you're having multiple migraines a month. But if you're already at the point that you're having multiple migraines a month, and you haven't gotten the relief, really, truly, find yourself a functional neurologist, because your migraines are a neurological disorder.
Yeah.
And if you're not addressing that neurological component, you're missing a piece to your puzzle.
Yeah. And the
all these other things that we're
medications,
talking about are probably factors in your migraines. But at the end of the day, the foundation is this neurological dysfunction.
yeah. And the medications, you know, some of them are helpful. And of course, a lot of people we see are because they're not responding to the medication or they don't want to be on the medication. But there's a lot of other side effects that come with a lot of those. But also at the same time, they can be a little bit helpful diagnostically if we know there's a certain medication that helps you, because we can look at, okay, well, what aspect of the brain is that predominantly affecting? And that is a little bit diagnostic for us in nature to do what we always do, is try to triangulate where is the primary area of dysfunction in your brain. And then ideally having the medication as an as needed thing, but hopefully not needing it. I mean, some of my patients, it's just wild to see they're on daily medication and they have like a concoction of abortives that are all altering your brain function. So it's just slapping a Band-Aid on it, and without a truly full understanding of like what are the long-term effects of that on your brain function, right? Sometimes I see patients who are taking abortives several times a week for years, and a lot of the long-term study, there's no long-term studies, or it's not recommended to be taking it in that way. And then as soon as we, work with their prescribing provider to stop doing that, then their headaches just start to get better in general, because the medication sometimes is a contributing factor at this point.
Yeah. And also those patients that come to us that aren't on a prescription medication, but they're self-medicating and they're taking like loads of BC powder or Excedrin on like a weekly basis, right? One, you're running into, inevitably, you're going to get rebound headaches from both of those things. And two, with migraine patients, they should not be on caffeine. And it's like this hard conversation to have with a lot of people in general, right? But then when we talk about migraines, it's like this misunderstanding, because we use things like Excedrin migraine, right? Or people drink a Coke or have a coffee and they're like, it got rid of my migraine. Well, it's because that cascade has already started. The cascade is full blown, right? And you've got this dilation of the blood vessels, and when you have the caffeine, it constricts them, it reduces your blood flow, and you get relief from that. But in reality, caffeine intake also perpetuates this cascade of neurological dysfunction in a migraine patient that we've been talking about. So it's like, it's this double-edged sword, and people don't like when you try to take the caffeine away from them, especially when it's like, well, caffeine helps my migraine. It's like, yes, when you have a migraine.
In the short term. Yeah,
acutely. But when you're continually exposing your system to caffeine, it's actually long-term perpetuating the migraine cascade of neurological dysfunction.
I feel like just like the way our brains work, right, is that's like such a frustrating thing. I feel like for all of us when it comes to things that are helpful in the short term or make you feel better in that moment, but that doesn't necessarily mean that it's the right thing to be doing, right? But linearly, we want to be like, oh, that helps, so that must be good for me. But not everything that helps is actually good for us long term. Yeah. So what about some of these other pieces? I know we don't have a ton of time here, but what about like endocrine piece? We know for a lot of women that, hormones and cycle are a factor. And the thing I talk to my patients a lot about when it comes to like functional endocrinology is I don't usually like to start with hormone testing itself, because there's other pieces of like your metabolics that are really important in your ability to process hormones. So that's where, we sort of start to delve into like, how's your gut function? How's your liver? Because your liver, is a really big player in your ability to metabolize hormones. So a lot of times, and, tell me kind of your thoughts, Dana, clinically that you see is I often, when people are becoming drastically more symptomatic around their cycle, I'm assuming more likely than not that they're having excessive estrogen. And if it's related to like liver or gut function, that maybe that stuff is not being processed appropriately. And then in some cases, right, if we kind of delve into that area and that's not the case, or there's other underlying factors within the reproductive system, then we might see some other situations. But I feel like a lot of times it's related to those two things.
Yeah, I think that one of the big things that I see with those patients that have, cyclical migraines or just fluctuations with their cycle in general, one of the biggest things that we tend to focus on first, and kind of to your point, is their blood sugar regulation.
Oh yeah, that one too.
And how much that affects their endocrine system,
Yeah.
as well as their like cortisol panels.
Mm-hmm.
And their sleep-wake cycle is a huge thing, right? And we look at some baseline hormones with patients up front, but if we need to like dive in and we've, really gotten the neurological piece under control, they're doing what they should be doing with their nutrition and all of that kind of stuff. If we're still seeing that cyclical aspect of things, and it's like that's when they're getting their migraines, then we'll dive in and do a little bit deeper look into what's happening with all of the sex hormones, and are they, converting things appropriately, because you may be just misconverting estrogen, right? Or you're not having good methylation pathways, so then, you see downstream effects to some of those estrogens, and
we
typically, even though a lot of times it's around women's cycles or it is cyclical, I don't go there first, because we've got to clean up a couple other things. And to your point, the whole system has to be functioning well. And sometimes we see those improvements even with what we're doing neurologically, because a lot of what we're doing is working on their autonomics. And I know we talk about this a ton just because of our patient population, but then you look at that extension through the hypothalamus into their endocrine system and what is happening with their hormones. So sometimes we see that even regulate without having to do anything to their hormones, because in reality, your brain's controlling a lot of that.
Exactly. And that kind of attests to even the biomechanical piece too, right? If we see, people's eyes are jumping around a lot, or they've got, imbalances in their vestibular system. Well, and I was just talking about this earlier today, I feel like I talk about this a lot, is all of these systems are hardwired together, right? Your eyes and your eye movements, the information from your inner ear, your vestibular system, and the stability of your neck. And that's really important, because as we move around, right, everyone needs to be telling the same story so that we don't feel dizzy and off all day as we move around. But a lot of times,
literally had this conversation this morning. She came in for the first treatment. These are all connected, and here's why you looking at this dot and me trying to move your head is very difficult for you right now. And as we go through treatment, this is going to get easier.
And that's why it's so cool, because we can do neurological rehab. We can couple that maybe with adjustments. But often when we start to study out their eyes, or, aspects of their vestibular system, the tension in the neck improves. Because a lot of times we see, it's called a cervical colic reflex. Your brain is compensating for maybe your eyes moving around too much. It tightens your neck up to send better feedback from your joints and muscles of your neck, so that your brain knows like where your head is in space. So a lot of times, you get that adjustment and you're like, oh, I get adjusted, and then it just comes right back, right? There's probably something else contributing. And then I feel like we always see people hold their adjustments better, or it actually works. That's the other piece, is sometimes people are like, yeah, I went to the chiropractor and, it didn't help my migraines. Well, that doesn't mean that it's not helpful. It just means maybe it was not helpful then, in that moment in time, right, where you were neurologically. And if we can get some of these other systems working better, then it may be much more beneficial for you.
Yes.
Yeah.
Absolutely.
And then what am I missing another piece? Anything else we haven't touched on that you think we should?
I mean, I think just we didn't really talk too much in depth about the nutrition thing. And it's worth trying to modify your diet and see if that helps. You know, the biggest thing that we see, I think, with migraine patients is like gluten and dairy intolerance. But I also hear a lot where patients are like, I was gluten free for, 2 weeks and didn't do anything. I'm like, it might not do anything. Or they're like, I was gluten free for a year and I still had a bunch of migraines. It's like, do they actually have an issue with gluten? Maybe, maybe not. But then it's kind of the same thing as the adjustment, right? Was it just not helpful because you had this neurological piece that wasn't being addressed or whatever? And, we do a lot of nutritional counseling with patients, but I always try to minimally reduce what they can eat as best as possible, right? Like I don't want to take away somebody's, every food that they eat, right? If we don't have to. But a lot of migraineurs already know this, but like citrus fruits, coffee, or chocolate, things like that, alcohol.
Yeah.
What?
Wine, and especially the ones with all the additives in them.
Yeah, like people know. And if those things are causing you to have a migraine event, then stay away from them, right?
Cut them out. And then at least, or even cut them out for a period of time, right? Our brain's about being adaptive. And if we can address all of these pieces, then ideally, maybe you can get to a better place where
maybe you can handle a little more.
Yeah, you could have that piece of chocolate and it's not going to send you over the edge one day, or you could have that glass of wine and it's not going to send you over the edge.
I do see that with a lot of migraine patients when they're like, I actually had a glass of wine last night. I didn't get a migraine this night.
Yeah.
That's awesome. Not saying you should do that every night, but it means your system is more stable, that metabolic capacity is better, your gut is probably improved, your liver function is probably better.
Yeah.
And your brain function is better. So
yeah. Awesome. Well, if you guys have any further questions, again, always please comment, like this, share it. Any questions you have, let us know. You guys are the ones driving which topics we're talking about each week. So let us know what you want to know, even if it's a topic we've already talked about, but you now have further questions about it, ask away. We'll answer them.
Yeah. And also, if you don't already, follow us on social media. These go up on YouTube, on Instagram, on Facebook. And we put out a lot of content on there. So if there are questions that we didn't answer here, they might be already on there. And, we'll keep looking at the messages and comments that we get from you guys and keep giving you as much information as we can.
All right. Good to see you.
Awesome.
Enjoy the rest of your day.